Scoliosis is a condition where the spine curves sideways. Imagine a straight line, now picture it with an S or C shape. That's what happens to the spine in scoliosis. This curve can make a person's shoulders or hips appear uneven. Scoliosis often develops during childhood or the teenage years, a period of rapid growth. While the exact causes are often unclear, we know it can be influenced by genetics, bone disorders, and neuromuscular conditions. As the spine curves, it can affect the alignment and function of the entire back, potentially leading to pain, discomfort, and even breathing problems in severe cases. In many cases, the exact cause of scoliosis remains unknown, referred to as idiopathic scoliosis. However, several factors can contribute to its development. Genetics plays a significant role, as scoliosis tends to run in families. If a parent or sibling has scoliosis, there's an increased chance of a child developing it too. Congenital scoliosis, present at birth, occurs due to problems with the spine's formation during pregnancy. Neuromuscular conditions such as cerebral palsy or muscular dystrophy can also cause scoliosis by affecting the muscles that support the spine. Other factors like injuries, infections, or tumors affecting the spine can also lead to scoliosis. Scoliosis often develops gradually and the symptoms can be subtle, especially in the early stages. One of the most noticeable signs is uneven shoulders, where one shoulder blade may appear higher than the other. Similarly, one hip might seem higher, or the waistline might appear uneven. Leaning to one side or having a rib hump, which becomes more prominent when bending forward, are other common symptoms. In some cases, scoliosis can cause back pain, muscle fatigue, and even breathing difficulties if the curvature is severe. It's important to note that mild scoliosis might not present any noticeable symptoms, highlighting the importance of regular checkups, especially during childhood and adolescence. Diagnosing scoliosis typically involves a physical examination and imaging tests. A healthcare professional will begin by observing the patient's posture, checking for any asymmetry in the shoulders, hips, or waist. They will also examine the spine's alignment while the patient bends forward, looking for any prominence on one side of the back. This simple Adams forward bend test is an effective screening tool for scoliosis. To confirm the diagnosis and determine the severity of the curvature, an X-ray of the spine is usually required. The X-ray image allows the doctor to measure the angle of the spinal curve, known as the Cobb angle. This measurement helps determine the appropriate treatment plan, which varies depending on the severity of the scoliosis. Treatment options, from observation to surgery. Treatment for scoliosis depends on several factors, including the severity of the curve, the patient's age, and the likelihood of the curve worsening. For mild cases, observation and regular checkups might be sufficient. This allows the healthcare provider to monitor the curve's progression and intervene if necessary. Bracing is often recommended for moderate curves, especially in children and adolescents still growing. The brace helps slow down or stop the curve from worsening by applying gentle pressure to the spine. In severe cases where the curve is significant or impacting breathing or other bodily functions, surgery might be considered. Spinal fusion surgery involves correcting the curve and fusing the vertebrae together to prevent further progression. Living with scoliosis, posture, exercise, and everyday life. Living with scoliosis often involves making adjustments to maintain a healthy and active lifestyle. Maintaining good posture is crucial, as it helps alleviate strain on the spine and reduce pain. Engaging in regular exercise such as swimming, yoga, or Pilates strengthens the core muscles that support the spine, improving posture and flexibility. It's essential to listen to your body and avoid activities that exacerbate pain or discomfort. Using ergonomic chairs and maintaining proper lifting techniques can minimize strain on the back during daily activities.